Welcome back to Conversations with Dental Friends, the podcast for dental professionals who want to shake things up, redefine their careers and actually enjoy what they do. This week I'm joined by Callum McCandless, who has a special interest in oral surgery and splits his time between Marlborough Clinic Belfast and Fortwilliam Clinic, which is part of Bupa. We're getting into what happens when you graduate and realise general practice maybe just isn't for you. Maybe you're feeling stuck or uninspired or just looking for a new challenge. This episode is all about finding that next step that reignites your passion for dentistry. Callum is seriously inspiring and I know you're going to take so much from this conversation. Let's get into it. Callum, welcome. Thank you so much for agreeing
my pleasure.
On your lunch break to take part in my little podcast Conversations with Dental Friends.
Not an issue, always happy to help.
Thank you so much. Callum and I have known each other for a while and work together in Marlborough Clinic in Belfast.
Yeah.
But let's rewind a little. Callum, take us through your career so far. How did you first get into dentistry and where has this journey taken you up until now?
Yeah, so I suppose if we go back to school time, I first decided to do dentistry because I didn't have a clue what else I really wanted to do.
That's such a common...
It's such a common answer, yeah. I feel like that's sort of the bread and butter way that people do get into it, unless people have family in it, which I did. My uncle and my cousin are both dentists, so I definitely had the exposure to it.
That's right, yeah, sir.
Yeah,
that's right.
Yeah. I just was always sort of decent at school. People were saying, you should do medicine or dentistry. It's the standard two that people pick.
And what A-levels did you do?
It's so long ago now, I can't even remember. Maths, chemistry and physics.
Maths, chemistry, physics. Okay, so you could have went into a lot of directions.
Yeah, so initially I was doing engineering, and then I thought the job scene in Northern Ireland maybe just wasn't the best for engineering. So
for sure.
Then the advantage I think with studying dentistry at that stage was that I think the income is quite good in dentistry, at least it was back then, especially whenever the NHS was at its peak. And I thought it was 2004, 2005, whenever I was deciding what I wanted to do for A-levels sort of time. And then it's kind of something that's always going to be relatively secure. So you know that people are always going to need their teeth fixed, everything's going to need patched up or repaired, or people are going to need whatever over time. So it kind of just developed from that. Then, as I said, my uncle and my cousin are both dentists. So Ross was doing dentistry. He was at university a couple of years above me. And I suppose it was just a natural progression.
He was a bit of an inspiration.
That's what it was, I'd say, yes.
And I think that we all kind of do these things where there's a comfortability in the familiar. You know, if you could pop into practice maybe and see what was happening.
Yeah, for sure. I went and work shadowed with my uncle. I thought it was interesting. It was a lot of working with your hands, which is something that I always liked to do. I necessarily didn't really love the studying aspect and the learning aspect, but I definitely was keen to do something with my hands. So it seemed to tick a lot of boxes that way. It's a very practical job.
And you studied here at Queen's?
Studied at Queen's, yeah. 2009 to 2010 to 2015.
My goodness, so that's actually not that long.
I know, my 10th year out, Rich. Crazy.
And then what did you have to do your vocational training then?
So when I qualified from Queen's, I decided that I'd done school in Northern Ireland, I've done dentistry in Northern Ireland, so I thought I would go then to try and do somewhere, to do my foundation training somewhere else. So I went to Bristol, which is great. Really enjoyed my time there.
Would you recommend that?
I loved Bristol. I think it was great to get away. I also think it was a nice time to get away because I spent a lot of my time at university with friends from school, which was brilliant. Wouldn't change that for the world. Really enjoyed my time in Bristol. I did my vocational training, had no interest in specialising in anything at all. In fact, I didn't really enjoy dentistry itself throughout university. And through foundation year, I found it all very stressful the first year. So didn't really see myself doing it for like 30, 40 years. But as we'll find out soon, that all sort of changed. Whenever I went to Bristol, I decided then that I'd done 3 years of general practice. I wasn't really enjoying it. I thought something has to change. I was looking at other avenues out of dentistry even at that stage. Then decided, okay, as a last ditch effort, I'm going to go back to hospital to do max vax because why not? I tried everything else and I wasn't super enjoying the practice side of it where you're just seeing patients on a more general checkup. Maybe.
And I think that's very brave to make that decision quite early on in your career.
Yeah, well, I think a general pathway for people is to do your foundation training, then decide that you're going to go and do DCT, so your junior clinical years in hospital. Whereas I was more so, had done 3 years, wasn't really enjoying it, was trying to find something else to do because I never really thought hospital really was my thing either.
Yeah.
So I'm very glad I did go back because I really enjoyed doing the hospital placements, getting in the MaxFax, doing surgery was really, really beneficial.
And what does MaxFax involve then on a day-to-day? Are you straight into further study when you decide to take that avenue?
You aren't. No, I did a locum year at the Ulster Hospital. I actually came back from Bristol for a year and did a locum year first, which I really enjoyed, so I wasn't locked into doing any further study, but decided that after that year, which was during COVID actually, 2019, 2020, that I really enjoyed it, so I wanted to do the DCT years. And what I felt was better with that is it was more teamwork environment. You're working with team a lot, it was a lot more social. You were getting involved in like very heavy surgeries, which were really interesting to see. Not the nicest thing to see, of course, because like a lot of head and neck cancers and things, but definitely the treatment was really nice to see it. And if you wanted to do something surgical, which I wasn't sure if I wanted to do, it was good to get a lot of hands-on in that, which is great.
And do you think that kind of rekindled a little bit of that love for dentistry or that passion?
Did. Yeah, definitely did. I think at that stage, I was done with general practice. I just really didn't like the monotony of it. I found it very boring. I was very bored for about a year and a half, 2 years, which isn't really great for any job, and you were just looking something different. Whereas the surgery side was constantly working with your hands. It's maybe a bit more final in that when you take the tooth out, for example, that's it, done, and you know, the patient goes off and that's them, which I quite liked. It was very satisfying to finish it. And then that coupled just with, I think it was a bit more like in-depth. It wasn't just doing checkups or x-rays or just doing fillings. It was more a teamwork environment in the hospital initially, which then pushed you down more the oral surgery route.
And there's that collaboration there that pushes you, I suppose, to be better and gives you an insight of the direction where that funnel's going.
Absolutely, yeah. And I met some really cool people in Bristol, all the consultants.
Everybody in Bristol is very cool.
Yeah, really
it's a cool place.
It is a cool place.
I know.
I really enjoyed it. I think the consultants there, Jacqueline Cox was great. I learned a lot from her. Tim Harris, also an oral surgeon, learned a lot from them. His wife Carla also works at Bristol Dental Hospital. So, and my VT trainer, Hashim El Wakil, he was really instrumental in getting me into the hospital initially too. So those are some of the people who helped me along the way. And then registrars, there's Bjorn Bartz, who I spent a lot of time with. He definitely sort of took me under his wing and showed me a lot of surgical techniques and things, which again just increases your enjoyment for doing it.
I think probably oral surgery is a lot of, as well, hours under your belt or things that you see, because there's only so much of it, I suppose, that a textbook is going to show you in terms of anatomy, in terms of what actually the patient's presenting with.
Yeah. I think there's a lot of like do one or see one, do one, teach one. You know, where you're definitely jumping in the deep end, having watched somebody do it, and then you're straight into doing that, which might be a little bit more complicated than the general things that you do in general practice. And I found that really quite interesting. So thrilling stuff. Thrilling.
So specialising, I know that you're not officially a specialist, Callum, and you have a special interest in oral surgery.
Yeah,
but specialising is a big step. What kind of training then did you have to do to make this transition, and what was the process like? You mentioned there actually being physically at the hospital and working with mentors, but is there a non-clinical educational side, a pathway that you need to follow?
Yeah, I think you've got one or two ways. You can do like the official specialism route, which would have been for me through oral surgery, which at this stage I still think it's super hard to get into. There's a lot of barriers put in place. You have to do a lot of publications, a lot of like...
As in like research
type bits and pieces. So it's a lot of academia involved in it. And also you have to have so many of those things ticked off before you even apply for the process to even be considered for it. So
you would need to really be, if you wanted to go down this official specialist route, I suppose you would have to be doing a certain amount of hours still in hospital now to get that research aspect.
Yeah, well, you would have had to, yeah. So you can do your DCT 1, DCT 2, and then you're sort of expected to do those bits and pieces if you wanted, in addition to your DCT 1 and 2 years, in addition to get onto the specialist training pathway, which I was already 3 years out of university, haven't done 3 years of general practice, and then I went to hospital for another 3 years, so I was 6 years out, and after every year you just want to do less and less of trying to get yourself just into the initial studying phase. I was kind of done with all my learning at that point. Well, not done, but I certainly didn't really have the passion to go ahead and go down the specialist route from scratch. Whereas I think you touched on it earlier, there's a lot of experience, a lot of like hours under the belt type thing, which I had more of because I'd done the hospital placement late, which put me in quite a nice position to then come out and just be able to feel as if I've done a lot of extractions. I've done a lot of like, I don't know, OSC repairs. I've done a lot of tricky wisdom tooth extractions, SC9 exposures or whatever it might have been from an oral surgery point of view that maybe puts you ahead. And I didn't want to lose that side of it to go and have to do a specialist pathway, which probably wouldn't have been that practical ultimately, or as practical, should I say, ultimately for me.
And was oral surgery something, whenever you were looking at your general dentistry day, was that something that you would have looked forward to more on your day, would have been extractions or something like that?
Yeah, I think that's why I decided to go into Max Facts originally, is because I always enjoyed like the extractions. I always enjoyed like tricky extractions. People find them quite stressful. Whereas
it's Marmite, isn't it?
It's one of those things. Yes. It's one or the other. I think you either love it or you just don't like it 100%. At all. But so yeah, I decided that because it was kind of the only thing that I was interested in, went into hospital, and then it just kind of went from there, as I say. And now, as I say, I'm a dentist with a specialist interest in oral surgery. I'm not a specialist at all, but I've been working in Marlborough for 2 years. I do a lot of complex teeth extractions, wisdom teeth extractions, tricky things, lumps and bumps that people need them looked at as well. So anything that I see can be referred to Max Facts at a later stage, but a lot of the people that we see are treated just in-house here, and that's it.
So you're working in a couple of referral practices now at the minute.
Yeah.
And would you say that if you were a dentist who on their day-to-day was working in general practice and thinking about specialising, what would your advice be for them? How do you know when it's time to make that move?
Yeah, I think I can't speak for anyone else but what I felt, and I just really wasn't enjoying going to work in the mornings to do general dentistry. I found it just very monotonous, and you know, I think certain people absolutely love that, and I wish that I did, because I think it's a really great career to be in. But just for me, I just find it a bit stressful. There's a lot of, you're seeing so many, it's fast paced, you're seeing so many patients per day. So yeah, definitely, like, to the guys who work in general practice, you certainly have a difficult job.
We'll take our hats off.
Yeah, 100%. But for me, it was just a bit more of what I actually enjoy doing, and what makes me want to go to work in the morning and not feel stressed all the time, which was surgery. So,
and I find that so interesting, because if I spoke to a few guys that I know that work in general practice, the thing that would stress them out on the daily
is doing the oral surgery side.
Is doing the oral surgery. I suppose that's why you're here, because then you do offer that referral pathway, and it does ultimately make your day nicer, but also someone else's day a lot nicer when they know they can refer those cases like that.
Yeah, 100%.
Because I see, just from what I see in day to day, is that an initial, what you perceive to be a simple extraction may not always be that simple at the end.
And a lot of it's just about the kit that you have. You know, you just don't have the kit in general.
So what would be your dream kit that you would have?
In general practice, you don't have any like surgical handpieces with water. I feel like that's the big thing that people tend to get scared of, using fast handpieces doing any surgical, which of course you should not use that. But certainly whenever I was in practice, that was always the thing, is I never wanted to do the surgical because I didn't want to give somebody a surgical emphysema by blowing air into the whatever it might be. So that's kind of the main piece of kit. And then we also have lots of other little bits and pieces that we use in our tray, like tiny little root picks to try and flick out the smallest pieces of root, or very fine luxators that we would use as well. So it's just different kit than what you have, and I feel like it's much easier when that's the case, when you have all that here ready. And
there's maybe not that investment in general practice.
You don't need.
I remember whenever I came to start working here, and there was these fabulous American Eagle hand squealers, and it is that excitement from having the right kit that you can do your job properly, because we want to do our best work, and definitely we can't do our best work in practice without having an extension of that
nice kit is expensive, but it does such a better job, and it makes the experience so much easier for the patient and also for you using it. definitely the way to go.
And although it is nice for us, definitely it's results, isn't it?
It is
It's
results,
replicable results that we can do time and time again.
Yes.
Callum, alongside your clinical work, you've also got quite the entrepreneurial streak. Can you tell us a bit about your other business ventures and how they came about?
Yeah, so again, it kind of brings me back to whenever I just wasn't enjoying dentistry. So I think I touched on it earlier. Like I used to go to work and just not want to be there for a period of about 2.5, 3 years. So
yes,
I started looking at other ways that I could branch out and earn money. So a lot of that was like investing in like property, for example, was a good one. So I bought a couple of properties which I now let out, which I find really interesting.
Very interesting.
Yeah, and it's something that I would do in addition to oral surgery, which is great because it gives you the ability to use dentistry as an option as opposed to a necessity.
Yes.
Of course, there's a bit of a learning curve with anything that you decide to do that you haven't done before, but I find the whole project of building a property or renovating it and then letting it out to be a really interesting and enjoyable experience. So I feel like that was definitely one of the
creative too.
Creative,
it's a creative avenue.
100%, yeah. So I feel like that has definitely given me the ability to pick and choose a little bit about how much dentistry I actually want to do, which is great. I'm in a very lucky position that way. The other bits and pieces are that I have a little company called Refine Aesthetics, which does Botox and fillers.
And you're actually very accomplished in your training for facial aesthetics.
That's right.
How did you train who did you train with, or how did that come about for you?
So initially when I was in England, I would have done some training for Botox with TMJ management for maxillofacial.
Yeah, that's good.
Which is really good.
I'd actually
nice way
dabble in that myself.
Yeah.
Given I would love to get that
100%.
done. For me,
it was a really good treatment modality for patients, and it was really straightforward to do, and it was amazing. I didn't actually think that it would have brought people that much relief because TMD is always notoriously one of those more tricky diseases or disorders to treat. So it was amazing to see that. And then when I trained under the consultant, he had sort of shown me the way, and then I decided with one of the MaxFax registrars that we would both go and do that course ourselves. He had also done a lot in his clinical practice, which was great. So I got a lot of exposure to that whenever I was in England. And then didn't want to lose it when I came back home to Northern Ireland about 3 years ago. So I decided that I would then set up my own little clinic and do it for aesthetic reasons and also for things like TMD.
I think that's such an interesting segue because I have done some training in facial aesthetics.
That's right,
I did it mostly from a financial perspective, to be completely honest, because I was looking on ways to level up my hourly rate, and I did some training over COVID and things like that. But I really like that you have moved into it from a patient treatment perspective and seeing how that can give somebody so much relief, and then moved into the aesthetic aspect of it. I think that's really great.
It's just an additional thing that you can do for your patients to a degree. So I would never have ended up doing treatment like that purely because of seeing it being done in MaxFax.
Yes.
Whereas now when I do it, it's almost second nature. But again, it's another string to your bow. It's another thing to do. It's another nice thing to know how to do.
And again, huge demand for it. Dip in and dip out of it. Once you have that skill there, it is a bit like dentistry that you can play that song when you need to play it. And if you don't play it for a while, it's not the end of the world.
Yeah, and I think that probably with those three things, with doing the oral surgery, Botox and fillers, and then property on the side, it's a really great balance for me at the minute. It takes a lot of stress out of the jobs because you feel like you're doing some extracurricular activities, which is really fun. So,
which brings me nicely on to my next question, which is, Callum, balancing multiple passions can be a game changer, and you were just sort of alluding to that there. Do you think having these different things on the go with these multiple businesses helps you stay motivated and excited for your oral surgery days as someone who maybe would have lost a little bit of passion for dentistry?
Yeah, I think in general it's been an absolute, as you said, game changer there for me, because I now come to work really enjoying myself. Like every day I actually want to be doing.
And you do enjoy yourself.
Which is great.
I hear you laughing.
Yes. I know, we had a lot of fun. We have a lot of fun. I do. So it's great. And I think, touching on that, it's like, I would say that I'm still, well, maybe not early, but I still think I'm quite early into my career and I'm really enjoying it, and every day, and I don't claim to be an expert in anything, but every day is a school day. You're constantly learning, you're constantly being taught things, you're constantly teaching other people, which again teaches you how to do things like running courses on, you know, simple like oral surgery, minor oral surgery courses or whatever it might be. It's great to be able to help people with things that I find are my bread and butter and be able to teach them a little bit, which is great. And then things like property, you know, it's a slow burner. It's a slow process, as you well know yourself, because I know that you're also
very
interested
in property too. Yes,
and it takes its time. It's just, it's just a nice, at the minute, a nice balance of all three. I don't find it. Would find it more stressful, I think, just doing one of them. A lot of people wonder how I keep everything going, but I actually find it easier to handle multiple.
When you're juggling
things,
because you can be a bit more efficient with your time, I think,
can be,
which is good. So you have also, Callum, stepped into the world of teaching. What got you into teaching, and what have you got coming up this year in that educational space?
Yeah, so that's a relatively new thing, Rachel.
Yeah,
you well know, which is great.
Absolutely, we're very well supported.
Yeah, we are. It's a fantastic clinic, yeah. And David and Brenda are both great with regards to like all of the continuous learning that everyone does here. So we ran an oral surgery course with Tim Harris from Bristol. He came across last year. It was really, really great. Both Tim and I ran that, which was it was just a great way of like starting to teach people. And I think as dentists, you're always guilty of, you think that you don't know enough, you think that you don't know what to be able to teach people, whereas I think a lot of people would find it amazing how good they actually are at something without even realising it. That's certainly, not that I claim to be great at it, but again, you certainly have better skills than what most people would have in a certain specialism like oral surgery. So
absolutely, and it's something that does terrify people all day to day. They want that easy.
Yeah, they do. They want that like easy fix for it. And we certainly found that whenever we were teaching the course, it was amazing. You know how many people sort of were asking you questions that you realised at that point, just having taught some people, that you did know how to teach them in an easier way. So it's the skills you pick up. It's nice to be able to sort of relay those, hopefully in a friendly sort of laid back manner, which we do at Marlborough, which is
I imagine it is very easy going, low stress.
Yeah, it is very low stress, and we try to keep it that way because I think people learn that.
And no egos as well, you know, like there will be people there that are there for all of it. There will be people there that are there for a sliver of it, but that sliver can be as much of a change in their day-to-day clinical practice as the person that's there for the entire thing.
Absolutely, and keeping everything collaborative as well. So people bring cases with them, they ask questions the entire time, we write things on the whiteboard, so it's great. It's happening on the 4th and 5th of April, so that'll be the second one, which would be good. We've got about 15, 18 people coming.
That's fab. And is it hands-on?
Hands-on, pigs' heads, the surgical experience. There's a few lectures in the morning, and then we just let everybody loose and trying to get as much hands-on experience as possible.
And is there going to be a raucous dinner afterwards?
There probably will be.
I can imagine there will be. Very good. And you're also looking at Marlborough Clinic's conference this year as well. You'll be speaking at that.
Yeah, so we're going to hopefully do a talk at the Marlborough Clinic conference on, I think it's 13th of June, isn't it? Yeah, so we're going to be speaking there about like the aid of CBCT use and how it can aid dental extractions, especially wisdom tooth and tricky teeth extractions.
And I think that's so important because you do have to lean into those changes in technology.
And it makes our lives so much easier having the CBCT machine in the clinic, so it's great.
Just that extra partner in crime, isn't it?
Yeah, for sure.
A lot of people, Callum, wonder whenever they're ready to teach, how did you know it was the right time to start teaching and sharing that knowledge?
I don't think I ever would have done any teaching unless David Nelson had sort of prodded me and poked me and supported me in the right direction, so I can thank him for that.
Yes.
It's been great. I think it's been something that I've actually really enjoyed, which has been good, even though I didn't really think that I would have that much. I've really got a lot of benefit out of it, and I think the people who've came to the course have also, which has been great. Certainly a lot of positive feedback, which has been nice. How did I know I was ready? I think I knew my stuff quite well with regards to oral surgery and how you treat it, because it's such a small little specialism.
Yes.
Specialism. The bits and pieces that I do at Marlborough it's a very niche type service, so there's a lot of similar things that come through, and you're doing a lot of the same bits and pieces every day, although there's a little bit of difference to it.
So it is like that 100 hours and you're an expert kind of
correct,
thing.
I would say so. And then We also offer sedation here too, so that's been something that's been beneficial to a lot of our patients coming in and being able to tell people how to manage like those tricky patients, not just the teeth, but how to manage people in general, like patients more so. I think it's just a nice way to be able to explain it and like an easy way of opening the floor up to people who might be struggling with maybe just dealing with difficult patients as opposed to the actual teeth themselves that need to come out. So,
and do you think having that training in sedation does improve you as a special interest oral surgeon?
Yeah, I think it's definitely another treatment that people would want to have if they came into the surgery, because a lot of patients who I treat are very nervous. They're not...
Yes, it's not that day-to-day dentistry.
Correct, yeah. It's a little bit more... People always assume the worst, even though the treatments are generally very easy and straightforward, but they always think that it's going to be worse than what it is. So it's nice to have something that you can treat people in a lower stress environment for them. And be able
for you too.
And for me too, yes, selfishly. But it's a lot less anxiety for them coming in, which I think is a massive benefit, really.
Excellent. And do you do additional training then for sedation?
Yes. So I've had
What
to do
does that entail?
Training. So it's basically a course that you do that you have to do 20 sedations, and then you get it signed off, and it's an online course. I can't remember the name of the course I did online, but I did it a lot of sedations in Bristol as well, so I had a lot of those under my belt before I even started the course.
Brilliant. Sorry, that was a bit of a tangent there, Callum. So coming back to the training then and being ready to teach, I suppose it's one of those things where just get going with it maybe and do it before you think you're ready.
100%. It's like anything, especially anything surgical, you almost have to go into it and just give it a go, because if you're constantly stressing about it, you'll never learn anything. It's getting out of your comfort zone with everything in life. You think you've got to push yourself, you've got to try and do some bits and pieces extra to see how you get on. And look, it's not the end of the world if something goes wrong. You've always got us at hand or people to call, which is also beneficial. So yeah, no, it's been really, really good. I would just say to anybody, if you're interested in it, just go for it. Just make sure that you're making the most of your course and you're doing what you want to do. I think ultimately is the best one.
And I suppose having a community of peers like you had before in Bristol, you and here, you can lean on them a little bit as well.
For sure, 100%.
So who inspires you in dentistry, Callum? Is there anybody whose career or approach really stands out for you?
I think I've taken a lot of different people's careers and sort of tried to merge them all into one. I have a friend of mine, Bjorn Bards, I talked about it earlier. He's a Max Fax consultant in Belgium, actually, and he did teach me a lot of surgical technique, which I'm really, really happy and thankful that he took the time to teach me.
That's so great.
Yeah, really, really good. As well as that, David Nelson's very inspirational. He's got his clinic in Marlborough. He's got a big and great business going, which is fantastic. And then other people along the way, like Tim Harris, I spoke about him. He definitely taught me a lot, and a lot of the crew from the Bristol Dental Hospital, just to get your confidence up. I've got a lot of people to thank along the way, which is great, and a lot of inspirational people that I've met, I think, so far, and it's only the start.
Exactly. You're so early in your career, a lot of inspirational people still to meet, I'm sure.
For sure. And I think one more point I would add is that for people who might not be enjoying doing it, or if they're still coming through and they don't know what they're going to do, is just not to worry about it. Just see how you go and just try everything. Just give it a go.
I bet you wish you could take that worry away from those first initial 3 years.
But I also think it's kind of a rite of passage in the way that it teaches you so much when you're not enjoying it. You almost have to go through that phase in order to get to somewhere where you want to be. Gritty, a bit of grit. A bit of grit.
Very good. Yeah. And finally, Callum, what is next for you?
What is next for me? I don't know. I really enjoy the teaching side of Marlborough, so hopefully I'll do a little bit more on that. I enjoy doing the surgical side. I would quite like to maybe do an implant masters at some point.
Oh, fun.
Which would be good, yeah. Yes. A little bit more hands-on, a bit more CPD as well, and meeting people at different courses, which would be interesting. I feel like that's the next logical step as well.
Yes.
Continue doing some property bits and pieces on the side.
Pro golfer?
Well, that would be nice.
That would be nice.
Oh, that ship has sailed, unfortunately, after Rory's big win at the
Rory did very well.
I just think as long as you're enjoying yourself, my week absolutely flies in.
Yeah,
it goes
that's
so fast.
True.
It is crazy, and as long as it keeps going like that, it means that you're enjoying yourself. I just think don't make work your everything. definitely is not my everything.
Yes.
Enjoy your time outside of work as much as you can.
100%.
And just don't do anything that you don't want to do. And if you find that you're not enjoying it, it's maybe time to say what's happened here and try something different for a bit.
Don't be scared to rock the boat.
100%.
Because the smoother waters are ahead.
That is a very nice proverb, Rich. Yeah, that's
So you say I'm quitting dentistry now. Poetry full time.
Yeah, I think that's pretty much what I would say to people is if they were stuck in any way or if they needed any career advice is just don't be afraid to mix it up, as you say. Just give it a go. And it might feel pretty stressful for a while, but it's the only way that you'll actually grow and get better at something, or you'll learn that you don't like it, and then it's just trial and error.
And what's the harm?
And what's the harm? Is right, yeah, absolutely.
Well, Callum, thank you so much for being part of this podcast. I really appreciate it.
It's been a lot of fun. Great to chat, as always.
A lot of fun, and good luck with the rest of 2025.
Thank you very much.
What an episode. I knew I'd say that about every episode, but what an episode. Callum has given us so much to think about when it comes to carving out a career in dentistry that actually works for you. If you're feeling stuck in general practice or just not loving where you're at, take this as your sign to explore those new paths and lean into areas of dentistry that actually light you up. If you want to check out more from Callum, I'll leave a link in the description to Refine, his spatial aesthetics business, and to Marlborough Academy, where you can stay updated on his courses. The Marlborough conference this year is full, but if you sign up to Marlborough Academy, you'll be one of the first people to know about future conferences and, of course, Callum's next oral surgery course. And if you loved this episode, it would mean the world if you could like, share, follow, subscribe, basically all the things. It helps get conversations like this to people who need to hear them. If you know someone who's feeling stuck in their career, send this their way. For a sneak peek at what's coming up next, follow Conversations with Dental Friends on Instagram at Conversations with Dental Friends, and you can find me over there too at Homegirl Hygienist. Thanks for listening. Same time next Saturday for another episode. See you soon.